Is Christy Williams, and she's a psychologist for the Birth to Three program. She's going to be talking about child behavior. And then I do just want to let you know, if you want to take a flyer, next month's class is a cooking class. It'll be free. It'll be in our big kitchen, and a chef from the area will be doing some cooking skills. So, or even if you just want to share it with other people. And we are on social media. Our name is Adulting 101, and you can find whatever's upcoming on social media, on Facebook, Instagram, stuff like that. And we have a YouTube page that has all of our videos, so you'll be able to find this talk afterwards if you want to go back and remember something she said. So that's it. All right. So I'm gonna go watch children.
I'm gonna move my stuff up here closer that way. Like Christy said, I primarily work with the Birth to Three program, so obviously ages birth to three. Majority of the referrals of kids that I see are generally ages 2 to 3, because usually you don't get referrals for behavior issues. So that 2-year-old mark and things like that. But prior to that, I worked in private practice doing evaluations with children that have learning disabilities and autism and things like that. And prior to that, I worked actually in a medical setting with adults and children who had neurological disorders, brain injuries, and things like that. So the brain is really my favorite thing. I love how it works. I love the medical aspect of it, but then I also love the behavior aspect of it. And so I guess behavior has always kind of obviously been the thing that I got called for. My kid isn't doing what I'm, not listening to me. They're not doing the things I want them to do. How do I make them listen? Why are they doing this? That type of stuff. And so I had some general strategies and some things that I thought worked fairly well, and some things that I could help families with, and strategies that we put in place. And then about 3 to 4 years ago or so, I got trained in a program, a therapeutic intervention called PCIT, or Parent-Child Interaction Therapy. And that really has been a game changer. Everything that I present today will be related to parent-child interaction therapy, along with then just other kind of behavioral types of things that aren't part of the research of PCIT, but are also related somewhat to just practices I've seen in general and things that I've seen work. So I'm going to start with a little bit of information about PCIT in general, just so you can kind of understand when I talk about PCIT, what I'm talking about. So PCIT started way back in the early 70s by a lady, a psychologist named Sheila Iberg. And then one of her students was actually Cheryl McNeil, who is a psychologist as well, and ended up coming to WVU to do some of her clinical work, and then started a PCIT lab at WVU, and it had been here for years and years and years and years. So I was fortunate enough to actually get trained by Dr. McNeil, which was amazing because she was one of the original creators of PCIT. And her brain and behavior are just amazing, and she can spew out related to behavior. So during that time, I realized PCIT is amazing. It was originally developed for children who had severe behavior disorders. So they were looking at children who had oppositional defiant disorder, sometimes children with ADHD that had challenging behaviors and things like that. And it really just focused on that population for many, many, many years. Then over time, especially in the last probably 10 to 15 years, they started trying it on different types of children. Children with anxiety disorders, children who have just delays in their development in some way, children who just struggle in general with being able to kind of manage and regulate their behavior and their emotions. And so over time, and just in the last 5 years, they've even targeted children who have autism and found it to be really helpful for children who have autism as well. So based on all that information, they've kind of figured out you can use PCIT with any child. And it doesn't have to be a child that has behavioral problems. It can be just your regular run-of-the-mill child. And the reasoning behind that is because PCIT, the model, is about relationship development. It's not just about discipline. It's first about relationship development and moving towards then what we need to do to manage behaviors if that still is a problem. And so after I went through the training of PCIT, I thought, I wish I had had this training prior to my kids being the age that they are, because I would have PCIT'd them 100%. Even if, we didn't have any major behavior issues, but I still would have absolutely used PCIT strategies with them every single day. And I still do to some extent, and my daughter was still, she's 12 now, so a few years ago, she still, could have kind of used similar strategies for PCIT, and I did that. So in general, PCIT is meant for ages 2 to 7. That being said, there is a PCIT toddler version for ages 12 to 24 months, and I'll talk to you a little bit about what that looks like. And then there are older children's strategies as well. So children up to age 10-ish or so, you can still adapt some of the PCIT strategies. Now, that being said as well, that doesn't mean that there haven't been lots of times that I've used PCIT strategies on my, when he was 16, when he was 17, he's 18, he's 19, I still use some of those PCIT strategies. And the main thing that, like I said, you're going to hear me preach this over and over and over again, is about the relationship. The relationship between the child and the caregiver is really the key to managing behavior in any situation. So that's a little bit about PCIT and why we're going to go there. What I want you to also remember is that in general behavior, when we think about the average child ages 2 to 7, their compliance is really only at about 62%. So, and that's the average kid. That's your average kid without any behavior issues, without any, special needs, nothing going on, 62% compliance. So if you ask them to do 10 things during the day, you would expect them to listen to you about 6 times. And that's normal, quote unquote, okay? So what we know is that if we use PCIT, if you use those strategies, that compliance rate bumps up to about 70 to 80%. So 7 or 8 times out of that 10 generally see more compliance. What we also know is that children who have severe behavioral issues, their compliance is about 15%. So 1 to 2 times out of the 10, you're seeing compliance. So that's with severe behavior disorders. And that is not your 2-year-old that's not listening, your 3-year-old that's not listening. That's with children who have really severe behavior disorders, which are typically not truly identified until 4 or 5 years old. Sometimes we can identify them much earlier than that, but generally they're a little older before I don't have a severe behavior disorder. So when we think about why isn't my child listening? And that's when we think about behavior, that's really what we have to think about. There are, what is the cause of this behavior? Why is it still happening? So I always tell people you would have to think about a few things. One is, the first thing that always enters my mind is, are their needs met? Are they hungry? Are they thirsty? Are they sleeping? Do they feel okay? And so those are the main issues. And I always tell people when you're thinking about behavior related to yourself, think about, what you expect from your child, is that what you also expect from yourself? So when I'm not feeling great and I want my kids to do something, it's probably not going to sound like it should sound when it comes out of my mouth. And that's the same thing for them. When they're not feeling great, when they're hungry, when they're thirsty, when they're sleepy, the things that they say and the behaviors that they display are not going to be what they're really capable of, because they don't have the skills to do that when all of their needs aren't being met. So we talked about, a little bit about the causes. Are their needs met? The other thing we need to think about when we think about causes of problem behaviors are, what is the goal of the behavior? Okay, and so if you take a child and try to get like a behavior analysis done, they're always going to break it down into that. What's the goal of this behavior? Most of the time, a goal of a child's behavior is to get, and you'll hear a lot of like official documents and things talk about attention-seeking behavior. I prefer to use the phrase reaction-seeking behavior because I don't, we have tons and tons of kids that struggle a little bit with their behavior regulation that get attention all day long. So it's not necessarily that they're seeking attention, they're just seeking a reaction. They're seeking that reaction from you to see if they can make it happen again. And that reaction is a form of attention, for sure. But being able to kind of figure out, is it attention seeking or reaction seeking? So what's the goal of the behavior? And there are differences. So sometimes the goal of the behavior is to get you to do something you've done every single time I do that behavior. Sometimes the goal is to just get you to pay attention to me. Sometimes the goal isn't related to you at all. Sometimes the goal is, I really want to play with that light switch, and I think it's fun, and it might serve 2 purposes, because I might get a reaction from you, but I also get to play with the light switch. So I've met two goals if I go over there and play with the light switch, even though I know I'm not supposed to do that. So we have to think about what the goal of the behavior is to the mitigating. And we'll talk more about this later, but when we think about the goal of the behavior, then we also have to think about, can we meet that goal in some other way? Can that goal be met without involving the light switch and without me giving a reaction? And the reason that we have to figure out how we cannot give a reaction is because the reason behaviors keep happening is because the goal is there, and then we provide whatever it is that's going to reinforce that behavior, and then we've maintained it. So, it's pretty much everything that happens throughout our day, our entire life, is related to what our goal is, what is maintaining that behavior, whether it's reinforced or not reinforced. And that's with us as adults as well. It's not just with children. If I walked in here this morning and these shoes kept making me trip, then I'm probably not going to keep wearing them to go places that I have to walk in. So everything that we do is related to decisions about what our goal is and whether or not that behavior is being reinforced by what we've decided to do. And a lot of that isn't something that we don't stop and think about it. Let me think, is this my goal? Has it been reinforced? None of that is it's not a conscious decision. It just happens because our brain has been taught that way. And my favorite way to explain that is that when we do behaviors to meet a goal, a pathway is formed in our brain. And when that pathway gets formed, it gets reinforced because that pathway gets accessed every single time we do that behavior. Every single time I try to go over and play with the light switch and somebody comes over and says no to me and puts me down, then that pathway gets reinforced. So the pathway that maybe doesn't get reinforced that I need your child to use is the one that isn't getting reinforced, and so it takes a back burner, so it's harder to access. My best way of explaining this is that some people, in the morning, I don't ever really have to think about where my toothbrush is because I keep it in the same place. And so I don't have to go to the sink and think, okay, I need to brush my teeth. Where is the toothbrush? Where do I keep it? It's not a process I have to go through. I can walk up to the sink, I can pick it up, I can put toothpaste on it, I can brush my teeth. Because it's there, and that pathway is formed. Now, sometimes if I've gone on a trip, I pack my toothbrush and it isn't there anymore. Sometimes I walk up and I'm like, oh, wait, where is that? And then I have to think about where it is. And that's a pathway that doesn't get used very often. So I have to stop and think, where's my toothbrush? And I have to go find it and bring it back. But most days, the pathway that's used the most doesn't require any effort from me. It just happens. That's the pathway that's been reinforced and reinforced and reinforced and reinforced. It's the one that gets used the most. So I can just walk up and grab my toothbrush, there it is. And so that's how it is with our behaviors too. When we do something over and over and over again, it doesn't require really any reinforcement anymore because it's kind of an internal reinforcer. It happens, it's easy to access. And that's the other tricky thing about the brain. It's always going to go to the easiest pathway. Always going to go to the one that's easiest to access. Because everything else is hard. If I hid my toothbrush from myself every night and then got up every morning, what a drag to have to stop and think where is that? Can I find it? Not fun to do. So our brains and our kids' brains are always going to access the most easiest pathway that's there. And that's the one that's been reinforced over and over and over and over again. We always have to, when I explain this kind of theory, we always have to think about the slot machine mentality. And that's exactly what behavior is like. So I tell people when we're thinking about behavior, you have to think about the slot machine. Because my behavior is my quarter. I'm going to keep putting quarters into the slot machine. Some of the time I'm going to get paid. Some of the time I'm going to get a big payout. Some of the time I'm going to get a little payout. Some of the time I'm going to get absolutely nothing at all. But I know that if I just keep doing it, eventually something's going to happen. Eventually I'm going to get paid. It may be big, it may be little, but eventually something's going to come out. And so my brain knows I just have to keep doing this. Eventually it's going to get paid. It's called an intermittent schedule of reinforcement. And that is the strongest schedule of reinforcement for behavior. And unfortunately, that's what us as parents use all the time. Because we can't be 100% consistent. Life is just not like that. We can't interact and engage and reply to our children exactly the same way every single time they do something. It's just not humanly possible. And so what we do is an intermittent schedule of reinforcement because sometimes they might touch the light switch and we're like, I'm just not dealing with it today. I'm just going to let them touch the light switch. I'll just let that happen. And then sometimes we're like, I'm going to deal with that right now. And we march over there and we get them down the first time they touch the light switch. And then sometimes we say, don't touch the light switch. I said, don't touch the light switch. If you touch the light switch one more time, I'm going to come get you. So it's a variety of interventions that we use. None of them are really the same, and the child has no idea what to expect because there's no predictability about it. Because sometimes we handle it this way, sometimes we handle it this way, and sometimes we handle it this way. And so that's an intermittent schedule of reinforcement because they don't know what they're going to get, but they do know they're going to get something. Sometimes it's going to be ignoring, sometimes it's going to be attention, sometimes it's going to be, a big reaction, sometimes it's going to be a little reaction, but they do know probably something's going to happen. And so that intermittent schedule of reinforcement, unfortunately, like I said, is the strongest one that's out there, and it reinforces that pathway over and over and over again. So we have to be careful about, like I said, we can't be 100% consistent, but that is a goal that we should work towards, not being 100% consistent, but being as consistent as possible, because that is going to be the biggest thing. And it's also, we know from research that also is one of the biggest strategies that children benefit from is consistency and predictability. If they know what to expect, then they do better with their behavior because they know exactly what's going to happen. There's no gray area for them because they know, oh, if I do this, then this will happen. And to some degree, to a big degree, that really becomes a life skill for them because for all of us, we need to make choices about, if I speed, I know I'm going to get a ticket probably. So we have a choice in that matter. And for kids, it's the same thing. They know if I do this, then I'm probably going to have a consequence for it. They need to be able to have that choice in their behavior and not just do things because I'm going to get in trouble. It has to be kind of a conscious choice on their part. So I already mentioned that I'm going to talk about relationship. You're going to hear me say that over and over and over again. Relationship really is the key, and that's really what PCIT is about, is creating relationship between the child and the caregiver. The reason that we need relationship to be strong is for a lot of reasons. One, if I have a strong relationship with somebody, a strong positive relationship with somebody, they're going to be much more likely to want to listen to me and to want to hear my point of view, to comply with what I say, those types of things. The other piece of that is that, it's really difficult. Like I tell people, again, to relate it to being an adult. Think about maybe you've had a job in your life at some point where the boss was just less than desirable, just wasn't the kind of boss you wished you had. And you didn't feel like you had a strong relationship or connection to that particular person. And when that happens, then when they come and tell you to do something, your reaction generally is, or you don't want to do it, or you do it, but you don't do it very well. You don't put your whole, effort into it, that type of thing. And that's a little bit of an example about why our relationship with our children needs to be the most important thing, because they are the most important people in our life. And so that should be the most important relationship in our life. And if that's the most important relationship in our life, then it should be the best relationship in our life. And if it's the best relationship in our life, then our kids are going to listen more and feel more connected to us. And connection builds compliance. So anytime we have connection, we get more compliance. So the main strategy that you're going to hear me talk about is called child-directed interaction. And basically that means child-led play. So it's where you're going to sit down with your child for a brief time every day and do child-led play. So you're letting them lead the play. And we'll talk more about what that's going to look like. So when you hear me talk about child-directed interaction, I always refer to it as CDI, just because it's easier to say that. CDI refers to that child-led play session. And there are several things that we know from a research standpoint, and I should have said this from the beginning, but PCIT is an evidence-based intervention. Because it's been around for a gazillion years, it's been studied and studied and studied and studied. And because there was a PCIT lab at WVU, there are always PhD candidates and people doing their theses and their dissertations on PCIT as well. So it's got extra research backing as far as that goes too. We don't have to wait until there's a grant. It gets studied a lot. And so a lot of the things that we know about CDI, and when I say CDI, I'm just talking about doing a brief child-led play session. And by brief, I mean about 5 minutes. 5 minutes a day. You're going to spend doing this child-led play session with your child. So building relationships, we know, creates more of a feeling of calm and safety in a child. We know that children that do a brief child-led play session with their parent every single day are calmer children. They're more regulated. They feel more safe. They feel more confident. They feel more secure. And those are, like I said, research-based interventions that we know. We also know that CDI is really about learning how to manage behavior with positive attention. So PCIT, like I said, is relationship-based. There is a discipline component to PCIT in terms of like if a child is not complying with what you tell them to do. But the discipline piece is really just supposed to be kind of your last resort. The main strategy of PCIT is to manage behavior with positive attention and not having to use discipline very much. Because discipline, again, creates kind of that negative coercive cycle. If you don't do this, then I'm going to do this, and then they get mad, and then you get mad, and then it just cycles and cycles and cycles and cycles, and nobody really gets anything from it. It also, CDI, doing those child-directed play sessions, helps us learn how to communicate more effectively with children. It also helps us be able to teach them to learn things and regulate their emotions more effectively than what they would if we weren't doing this child-directed play session with them as well. We also know when we do child-directed play with children, they're less frustrated. Some children who have really high difficulty with regulation get frustrated really easy. Their frustration tolerance is low. And we know that if we do a child-led play session with them, their frustration tolerance gets better and better and better and better. And with frustration tolerance comes more regulation. We know that it improves social skills. So when you're doing a child-led play session with a child, you're teaching them how to interact with people. And what we know is that when children who have gone through PCIT and used these child-led play sessions with their parents or caregivers for years, end up being children later on in life who have stronger and more positive interactions with their peers. Because what happens is they end up talking to their peers the same way you're going to talk to them during their child-led play sessions. So they start to learn that because you're modeling it for them the whole entire time. So they start to transfer and generalize those skills to their peers as well. We also know that using CDI, and you're only doing it for that brief 5-minute play session, but using CDI every day just makes the interaction more enjoyable for you because, first of all, you limit it to 5 minutes. You're like, I only have to do this for 5 minutes. I only have to maintain this for 5 minutes. And you get to point out, during that 5-minute time, you get to point out all the awesome things that your kid's doing, which makes you feel good, which makes them feel good. So it gives you at least 5 minutes a day that everybody feels great about what's happening between your relationship and your interaction. So first thing that we're going to talk about with your CDI skills, what you're going to do when you sit down with your kiddo, is there are some don't skills, things we're not going to do. During that 5-minute play session that you're going to do with your child, 3 things that you're not going to do. You're not going to give them any commands. Okay, so no commands, 0 is the goal, 0 commands. And by commands, I mean direct commands and indirect commands. So indirect commands would be things like, can I see your phone? That's indirect command. She complied, but it was an indirect command still because I asked a question and I expected her to hand me her phone. A direct command would be, hand me your phone. I didn't ask the question, I just told her to do it. So no direct commands or no indirect commands. We're going to talk much later about when to use each of those. They each have their place. But during your 5-minute special time, you're not going to use either of them. You're not going to give any direct commands at all. Because the main goal of that special time with your child is that you are going to let them lead the play. And so if you're giving a command, you're probably not letting them lead. You're, if you're saying, hey, let me use that block, that's an indirect command. Or if you say, hey, let's build a big tower, indirect command. Hey, put this blue one on top of there, direct command. But none of those are allowing the child to lead the play. It's us leading the play. Us telling them how to play and how to do it. So during that 5-minute time, you're not going to do any of those things. You're not going to give any commands at all. Now, one of the reasons, the general skills of CDI, or child-directed interaction, a lot of them you can use throughout the entire day. Some of them you can only use during that 5 minutes because it's just not possible to use them all day long. The don't skills is an example of that. obviously can't go all day long without giving your child commands. So, but you can go 5 minutes. All of us can go 5 minutes without giving our child a command. We don't realize it, and sometimes during that time it seems hard to catch ourselves like, I was gonna say that, I can't say that. So it's a little bit of a wake-up call for us as well. We don't probably realize how many commands we're giving to our children all day long. And that's another one where I tell people to try to think about that as an adult. If you heard as many commands as your child hears all day long, would you want to be that compliant as well? Come get your shoes, come eat breakfast, sit on the floor, quit standing on the couch, bring me your toys, go get your teeth brushed. Like, it's all day long that we're barking out commands to our kids. And if I lived that life, I probably wouldn't want to be real compliant either. So we do have to kind of keep our commands in check, and doing a 5-minute practice every day where we don't give commands helps us kind of get, create a little bit of, just comparison of what we're doing the rest of the day. So 0 commands during that time. There are a couple other reasons that we don't do commands during our special time. One reason is that if I give a command to my child during special time and they don't comply with me, then I have to decide how I'm going to respond to that. So if I said, hey, put this block on top, I think it would look cool, and they say no, then I have to decide, do I just let them not do it, which is then teaching them that they don't have to listen to the things I tell them to do, even though it was a play command, it's still a command. So do I say, oh, okay, you don't have to listen to me, don't put the blue block on. Or I have to decide, am I going to put a consequence in place? And do I really want to put a consequence in place when I'm trying to build a relationship with a child? Probably not as well. So that's the other reason we don't give commands, because then we're not setting ourselves up for failure. We're not setting them up for a situation where it doesn't feel good. They don't want to play with us anymore because it's happened. So commands, 0 commands during that time at all. The other thing you're going to stay away from is you're not going to ask any questions. That's a really hard one to do, especially with the little kids, like the 3-year-olds probably too. Because with little ones, they're developing language, and we're trying to act like we're really super interested in what they're doing. Oh, are you building a tower? And we are being interested, but we're also not allowing them to lead the conversation. And during that 5-minute time, we want them to lead the conversation along with the play. They're pretty much leading everything. There's going to be some exceptions, and we'll talk about that. But we want them to lead the conversation too. And if we're asking questions, you're leading. So we can make comments like, oh, it looks like you're building a tower. Not a question. It's just a comment. It's just an observation. So anything that we want to talk about, we can, but we're not going to do it in the form of questions. And because also, too, sometimes questions are hidden commands. Like, do you want to put the blue block on? Meaning, I think you should put the blue block on. So we just stay away from questions because they can to a lot of us leading things instead of the child leading things, and also into us, creating a scenario where we're leading the play. Like, the third thing that we're going to have 0 of during that special time with our child is 0 criticism. And sometimes that seems like an easy thing, like, oh, I don't really do that much during play. During play, I'm pretty happy. But what we don't realize is that sometimes we're criticizing without criticizing. So, our kids are going to build a tower, and we know that if they put that block on there, it's going to fall over. And generally, our tendency as adults, as parents, we want to help them not let it fall over. And so we say, oh, I don't think that's going to work. We're not going to do that during our special time. We're just going to let them do it. If it falls over, it falls over, and that's okay. It's okay that it falls over. We say, oh, it fell over. You can try again if you want to. Because again, we're letting them lead the play. So by adding that if you want to it, gives them the ability to decide, do I want to build another tower, or do I want to move on to something else? So 0 criticism. Sometimes during our playtime, we'll have a kid that'll throw the block, or something like that. And we say, oh, you're not being nice. Again, a criticism of their behavior. Warranted, I understand, but still a criticism of their behavior. And we're going to handle that in a different way compared to saying you're not being nice, or I don't like it when you do that. Still a criticism of behavior. We're going to stay away from any of that, because these don't behaviors are directly leading into the fact that any behavior we pay attention to is the behavior we're going to see more of. Any behavior that gets attention is really that simple in terms of behavior theory. Any behavior that gets attention will go on. So if they throw a block and I say, you're not being nice, throwing a block the next time is going to get a reaction, and they know that because they got a reaction that time, so it's probably going to get a reaction the next time. So we just have to be really careful about what behaviors we pay attention to and which behaviors we don't pay attention to. Okay? So those are the don't skills. And I'm going to give you guys a handout too that has these listed on it for you. So those are the don't skills. Next, we're going to talk about the do skills. The do skills are one that you're going to concentrate on really doing a ton of them during your special time, but you can also sprinkle them throughout the day. And the better you get at them during your special time, the more you're going to hear yourself talking like that throughout the day. My kids will say to me, quit PCIT talking me, because that's how I talk all the time now, because I work with toddlers, so every day when I go to work, I talk that way. And so when I get home, I talk that way too. And it does work on spouses sometimes. I mean, I'm just saying, you can PCIT them a little bit too. It works a little bit. So, and again, it works with my older kids, even though they recognize that's what I'm doing, it still works. You know, they might not, they tell me to stop, but it still works. So, you know, you can use these skills with your little ones, but you can also sprinkle them throughout the rest of your life as well. So, the do skills. In order to remember them, they created the acronym PRIDE, and each letter stands for something. The P in PRIDE stands for praise, and that's a pretty obvious one. When we're trying to build a relationship with somebody, we want to say nice things to them. And so having that praise component is really important. You know, if I walk in someplace and somebody says, hey, I really like those pants you have on, then I've already created a bit of a connection with that person because they said something nice to me. Praise is really important. If I walked in somewhere and they said, oh, those shoes are probably not going to be great to sleep in, then I thought, geez, thanks. You know? So that praise piece is really important in terms of creating relationships. The P for praise is important. Praise is great. So when we say, good job, buddy, all of those things are important. For the purposes of it having a therapeutic effect that impacts behavior, we need the praise to be something called labeled praise. Labeled praise is a praise that has a tail that tells them exactly what it is you like. I love how you're sitting so nicely in your chair. You're being so careful with your drink. I love how you're drinking all the time. You're so good at drinking the drink. So you're being very specific about what you liked. The difference is that oftentimes we don't mention these things. Like when I sit with my kid, you know, when I was sitting when they were younger and stuff, I didn't often say to them, you're doing such a good job with your drink. I mean, as long as their drink was on the table and it wasn't getting spilled, I probably wasn't mentioning it. But now I know if their drink is on the table and it's not being spilled, I should talk about that. I should talk about the fact that their drink is on the table not being spilled. And then what happens is, their next time it's like, oh, check out how I'm keeping my drink on the table and not spilling it. You know, it's important for them to hear that. So they need to know exactly what it is you're expecting of them. And for little kids, that's really important as well because they move quickly. And so if they do something and I say, good job, they probably have done 3 more things before I got that out of my mouth. And so they will know exactly what it is I'm saying good job about. But what does happen is if they spill their drink, I'm probably going to say, you have to be careful with that. I told you to be careful with it because I didn't want you to spill it. So they didn't get any attention for keeping their cup on the table nicely and safely. They got tons of attention. So it's really about flipping how we talk throughout the day. Because throughout the day, we pay attention to all those behaviors that we think need attention because they're not safe or they're messy or they're going to cause a problem. So those are the behaviors we think we need to pay attention to. But in reality, we need to be paying attention to all the opposites of those behaviors. We need to be paying attention to how nicely you're sitting in your chair. I love how you're sitting and playing with your toy. Really, you're just being so sweet to that toy. You're being so careful with it. We're going to get to play with it again tomorrow because you took such good care of it. So we're going to talk about all the awesome things that they're doing throughout the day. And again, that doesn't mean you're not going to pay attention to the things that are a problem. But we need there to be a really disproportionate equation between how much we pay attention to the positive behaviors and how much we're paying attention to the negative. Because most likely, if you look back through the average throughout the day, you're probably paying more attention to things you don't want to happen. Because as parents, we feel like that's our job. We have to stop them from doing stuff they shouldn't be doing. So just try to think about that ratio throughout the day and make sure that your labeled phrases are way up here. And that's why the special time works, because you're gonna spend 5 minutes doing nothing but labeled phrases. You're not gonna correct them at all during that time. And so it's basically like a therapeutic dose of medicine. You're giving them positive labeled phrases for 5 minutes. When we do it from a therapy standpoint, like clinically based, we want the parent to do at least 10 labeled phrases during that 5 minute time. So 10 times during that 5 minutes, you're going to say something that you want them to do more of. I love how you're playing with that. It can be about how they're playing. It can be about how they're looking at you. It can be about how gentle they're being. It can be about how they're sitting so nicely in the spot. It can be about anything, but 10 things that you want to really draw attention to because you'd like to see those things happen outside of your special time as well. Okay? And we know that that's what happens because during that special time, you're having your connection is really increased during that 5 minute special time because it's one-on-one. And so that child then is going to generalize those things that they heard you say to them more likely outside of that special time as well. So 10 labeled phrases. The R in pride stands for reflections. Reflections for our verbal kiddos mean that we're just going to reflect back any communication they give to us. Because again, this is how we're letting them lead the conversation. So if they're, driving a car and they're going, we're going to take a car and we're going to say, so we're just repeating back to them anything that we think that's appropriate. Now, if they start saying, I hate this car, we're just not going to reflect that back. We're just not going to pay attention to it. We're not going to repeat it. We're not going to tell them not to do it. We're just not going to reflect it. But if they start saying, oh, I love this car, you're going to say, oh, I love this car too. And you're just going to repeat back the things that they say. So reflections can be just repeating exactly what they say. It can be paraphrasing back what they say. Or if children are doing nonverbal communications, it can be you verbalizing what it is they do nonverbally. So if they reach for something, then you can say, oh, you would like to have that car. You're just going to give words to whatever it is they're displaying. If they look sad, that's a communication, and then it's appropriate communication. Oh, it looks like you're feeling sad. If they laugh, you can reflect that back. Oh, you're laughing, that means you're happy. You're reflecting that back to them as well. So you're just reflecting back any communication they put out there if it's communication that you approve of. So if it's communication you don't approve of, you're just not going to reflect it back during that 5 minute time. Okay. So the I in pride stands for imitation. Imitation, let me back up a second. Reflections, we want to try to get at least 10 of those in as well. If you have a verbal child that talks enough, try to get 10 reflections in during that 5 minute special time. The imitations are just when your child is playing, you're just going to imitate what they're doing. So you're going to try to do the same things that they do with their toys. You're going to copy them, basically, for a couple of reasons. One, when you copy them, they're going to be more likely to copy you. And all learning for children comes through basically copying us. They learn how to write because we show them how to write, and they copy that. They learn how to talk because they're copying us saying words. So we're modeling the things that we want them to do. They're going to be more likely to copy us if we first copy them. And that happens from the time that they're little. So, we hand them a rattle, they shake it, we shake it, and then they're like, oh, see if I can do that again. So they're learning through that copying behavior. Gradually, what we want to happen is that we want them to copy us without us first copying them. But they learn to do that by us copying them. The key to this one, though, is that you're only going to copy things you approve of. Again, so if you're doing your 5 minute special playtime and they throw a block, you're not going to throw a block. You're just going to keep playing. But if they put a block on top of the tower, you're going to put a block on top of the tower. The other piece of this imitation thing is that when you're doing your 5 minute special playtime, you're only imitating what they do, which forces you to play at their level. You're playing at their developmental level, which allows them to lead the play again. If you're not playing at their developmental level, they might have a tower over here that has 5 blocks and you build a house. And that doesn't make them feel like they've led the play. It just makes them feel like you're doing your thing, they're doing their thing. But during their play, you're just going to copy them. They put a block on, you're going to put a block on. And that imitation, kids love to be imitated, so if they're jumping and we jump, they think that's really super funny. So, and that happens with play as well. It also happens with their behavior. So if they're sitting very nicely with their cup at the dinner table, you might say, you know what, I'm a great spot for the cup. Put mine in that same spot where like you have yours. So you can relay that imitation into the rest of the day as well. It doesn't have to just be about play. It can be about other things too. So we don't count the imitations. You don't have to have so many imitations. It's just something to be conscious of as you're sitting and playing with your child. The D in PRIDE stands for description. This is the one that I think is ultimately the most awkward one to do, but then ends up being the easiest one to do. So the descriptions mean behavior descriptions, and it basically just means you're narrating what your child is doing during the play. Put the blue block on top of the red block. Oh gosh, you're building a really big tower. You're driving the car over top of that. You're using the green crayon and drawing circles. You're just narrating. So it seems a little weird in the beginning, but honestly, as time goes on, it's the easiest one to do because all you have to do is look at them and talk about what they're doing. And that one is one that we also count. We try to get in at least 10 behavior descriptions as well. So 10 times you're going to comment, you're going to narrate what they're doing during that play session. Behavior descriptions also, we know that if you have a child that you think has decreased attention span, difficulty focusing on a task, behavior descriptions increase the amount of time that they can focus. So this is one that's been studied quite a bit actually. And if you take two kiddos and one of them has difficulty focusing, both of them have difficulty focusing, and you start narrating what they're doing, the one that you're narrating will do the task longer than if you just sit and watch. So if they're both coloring, and for this one I'm saying, you're using the green crayon. Oh my gosh, you drew a circle with the green crayon. Oh, now you picked up the red crayon. Oh, you have the red crayon and the blue crayon in your hand. This kid's going to play with the crayons longer and scribble longer than this one where I'm just watching. We're just coloring beside them. So that behavior description really increases focus and attention, and that transfers into the rest of their life too. The ability to focus and attend to a task improves if you do behavior descriptions with them. So 10 of those as well. The E in PRIDE just stands for enjoyment. So you have to actually act like you're having fun during this 5 minutes of special time. So your voice has to be a little more excited than maybe what it is the rest of the day. It can't be like, you're using the blue crayon, you have the red crayon. It has to sound like you're having a good time with them. We don't measure that one either, but it's just kind of your tone of voice there. So 10 labeled phrases, 10 reflections, 10 behavior descriptions. That's 30 things in a 5-minute period that need to be said in order for the play to have a therapeutic quality to it. 30 things in a 10-minute period means that we need to be saying something about every 10 seconds. About every 10 seconds, you need to be using one of those skills. When you first start doing this, you're probably going to find that it is a little bit difficult. You're not going to get that 10, 10, 10. You're not going to hit those the first time you do this. It'll be trickier than you think. But if you do it, it will get easier and easier and easier as time goes on. We do know, again, through research, that you have to do this at least 5 days a week with your kiddo in order for it to have a therapeutic effect. If you do it less than 5 days a week, it just doesn't. 7 days a week is best, but no less than 5. We try to tell people to think of it, to remember it like a medication. Take your medicine every day, it has the effect you need to have. If you miss a few days, it starts to not be as effective as what you need it to be. So it needs to be in your system every single day. It needs to be in their system every single day for a couple of reasons. 1, so that it's beneficial to them, and 2, so that you get good at the skills. Because these are the skills, like I said, these are the skills that you're going to use to manage behavior. And so they have to be automatic. They can't be ones that you have to stop and think to the situation. These CDI skills are your go-to skills for managing behavior. So you want them to be automatic, that you don't have to think about them at all. And by doing them every single day for 5 minutes, they become automatic. Like I said, it's how I talk. When I go to like family, reunions or things like that, or I end up just talking to the little ones because that's what I do. And then they all just kind of listen, and they're all playing, and people are like, what are you doing? What kind of magic? Like, it honestly is a little bit of magic. People always say, we don't have a magic wand. I kind of do have a magic wand, and I can teach it to you because it's really not hard. So using these child-led CDI skills really are what it takes. Oftentimes, it's easy for me because I'm trained in this. But when I go to places like a family reunion or something, and there's a lot of little kids running around, and I just watch, I can see why they gravitate towards me instead of towards some of the other people that are trying to interact with them. Because the other people that are trying to interact with them are saying, hey, you want to play ball with me? Come play ball with me. Come over here. Come do this. I'm going to take that off. I'm going to take your hat. I'm going to take, So there's a lot of like trying to get them to interact with you, but it's a lot of like questions and commands and things that really just don't feel great. Don't feel like connection. Whereas I'm just saying, that's the ball you have. You're doing a really good job holding it tight. You really tight so it doesn't get away. That's the coolest hat I see on your head. I love that hat. It's a really cool blue color. And so I'm just narrating and I'm just commenting on things. I'm letting them, if they come close to me, that's great. If they don't, that's okay too. So I'm not putting pressure. And by doing that, children then tend to come to me more and want to interact with me more. And again, it goes back to that concept that we talked about with CDI, making children feel calm and safe. They feel calmer and safer when I'm interacting with them like that than when I'm threatening to take the ball from them, or I'm going to get you. If you have a good relationship with a child, they're going to love that. But if it's a kid I just met, they're going to be like, oh, this is scary. So, trying to use those CDI skills, letting them lead, that's really, really important. And that's where connection gets created. So the do skills, like I said, what did I do here? When we're doing our special playtime every single day, in the beginning, it probably will look okay. Most of the time, it starts out okay. Sometimes in the beginning, it can still be a little bit tricky. We do have kids that try to push boundaries a little bit, especially in the beginning. So you're like, yeah, we got one of this. So sometimes, we are in a situation where we have to manage behaviors during that 5-minute special playtime, but we're not allowed to use commands or questions or criticism. So we have to know how to handle those behaviors outside of that. Your main strategies for managing behaviors during your 5 minutes, this is just during your special time, and we'll talk about outside of special time too, but during your 5-minute special time, your main tool is going to be that you are going to use what we call selective attention, which means you're not going to pay attention to it, you're going to ignore it. So as long as it's a behavior that the purpose, again, we're going back to the beginning where we talked about what the goal of the behavior is. If you think the goal of the behavior was to get a reaction from you, then removing your attention from it is the biggest consequence and the most effective consequence you can give. Okay? If the goal was to get attention, then remove the attention. That was the goal of the behavior. So if you're playing blocks with them, and they start throwing blocks. And one of the best tools for kind of determining whether or not it was an attention or reaction-seeking behavior is if they look at you after they do it. They throw the block, and they might not look at you directly sometimes. But sometimes they'll throw the block, and then they'll just kind of glance at you to see if you're going to say anything about it. Now, the most important thing to remember about ignoring behaviors or using selective attention is that if you ignore a behavior, it is going to increase before it gets better. So you have to decide when you start ignoring a behavior, can I ignore this behavior for an entire 5 minutes? At the end of this 5 minutes, I can walk away. That's my 5-minute special time. It's all done. But if you don't think you can ignore that behavior for the entire 5 minutes, then don't start ignoring it at all. Because if you ignore it for 2 minutes, and then you think, oh gosh, I can't stand it, and then you pay attention to it, all you've done is reinforced it and made it stronger than what it was to begin with. Again, back to the slot machine. So if I put 15 quarters in and I don't get anything, and then I put my 16th quarter in, I just figured out, I just got to do it again. I just got to do it one more time. And that's the same thing. If we try to ignore a behavior and then decide I just can't do it, and then we pay attention to it, it's that 16th quarter. So we've just strengthened the behavior, actually, instead of trying to reduce it. So we have to make sure that we're not inadvertently reinforcing behaviors. when we don't need to be. So selective attention. Selective attention meaning ignoring the behavior, but selective attention or ignoring the behavior is most effective when you combine it with something that I named passive redirection. And we've all heard of redirection, but redirection in its kind of heyday was typically about using commands and things like that. So a kid's doing something that we don't want them to do, and we start, hey, come over here and check this out. Come over here and play this with me. That's kind of an active redirection, but it also involves commands and direct commands oftentimes. Come do this. And so for PCIT, what we use is more of a passive redirection. So we're sitting and playing blocks, and they start tossing blocks. And it may be for attention, or it may just be because sometimes little kids throw blocks for no reason and they think it's fun. Either one of those this applies to. They start throwing blocks. We're just gonna, so if I'm sitting and playing with my kid, and they're sitting beside me, or you want them to be kind of across from you, and they start tossing blocks, I'm just gonna subtly turn a little bit. I'm not gonna turn my back to them because I'm not being rude. I'm just gonna turn my body a little bit, and I'm gonna pick up a different toy than the blocks. I'm gonna start playing. And in addition to that, I'm gonna start talking out loud about what I'm doing. Oh, I found Mr. Potato Head! Oh, I'm gonna give him silly eyes. He's gonna dance. Mr. Potato Head. I'm dancing with Mr. Potato Head. So you're gonna start playing something different than what they're playing, and you're gonna make it sound like it's the most amazing thing you've ever done, and the most fun play you've ever done. So they may keep throwing blocks, and they may throw them more because you're not paying attention to them. You're playing something else, so they might start throwing them more and more and more and more. If you started ignoring it, you have to keep ignoring it. Keep playing with Mr. Potato Head, talking about it. Eventually, one of two things are going to happen. They're either going to stop throwing blocks and come over and join you, or they're going to stop throwing blocks and just play with blocks the right way. Either way, both of those things are positive behaviors. So if they stop throwing blocks and start building them again, then you're going to turn back around and, oh my gosh, you put the red one on top of the blue one. I love it when you make those two colors together. That's really cool. Or they're going to pay attention to your potato. Come over and start paying attention to it. And you're going to say, oh, thanks for coming over to play Potato Head with me. I love it when we get to play together. So you're pointing out a couple of things. One is positive behavior that you're playing with the potato. Two, that you're doing it together. So you're bringing that up. You're mentioning the fact that the interaction is more fun because it's done with the child. And that's a label praise, basically. Thanks for coming over and playing with me. That's increasing that positive behavior. So that's a selective attention with a passive redirection. Selective attentions are much more effective if we combine them with a passive redirection. If we just ignore it, we just turned and sat, still effective, but not as effective as if we use a passive redirection at the same time. Because if we just sit and ignore it, that behavior, that throwing of the blocks is really going to increase because there's nothing distracting them from doing it. So using a passive redirection is much more effective. And sometimes it takes a little while, and sometimes you've got to be really creative about what your play activity is going to be. Now, ignoring, using a selective attention with a passive redirection is the most effective way to manage reaction or attention-seeking behaviors. That type of consequence or intervention does not work for aggressive behaviors. So if you have a hitter, a biter, a kicker, a thrower at you, and I do differentiate those. So if I'm playing with a 2 or 3 or 4-year-old and they throw toys, to me that's a reaction kind of seeking behavior, or possibly just a 2-year-old behavior. If they throw something purposely at me, look at your face and do it right at you, that's an aggressive behavior. And so hitting, kicking, biting, throwing something at you is an aggressive behavior. The goal of that may have been to get a reaction, but it also is aggression, and it can't just be ignored. Because aggression doesn't go away by ignoring it. It just... So if you're doing your 5-minute special time, and they hit you, or throw something at you, or something like that, that's the one and only time you end your special time before your 5 minutes is all done. So we're playing, everything's going great, and then all of a sudden, I'm going to say, our special playtime is all done today because I want to. and you don't do special time again that day, try again the next day. And they're probably going to test it a few times. Like, are they going to end special time every time I do this? But you just end it and you walk away. Your voice is still very calm and very controlled, and the eye contact is minimal. Special playtime's all done because you don't, no big reaction, you know. One of the tricky things sometimes parents have difficulty with in this situation is managing their nonverbals. So sometimes we'll have family, moms and dads, me included, that will get an eye roll or a sigh. They kick you and you're like, or they'll look over at their spouse like he kicks you and they're like, so all of those nonverbals are still a reaction, and they're still a quarter. It's still a quarter gone in the slot machine. So we call it robot face. You have to go into robot mode. Special playtime is all done. You walk away and you use that exact same line, delivered in the exact same way every single time. Because over time, it gets very boring to just hear, special playtime is all done because you kicked me. That's all they get eventually. So my analogy for that one is always, that's when they figure out that there's an out of order sign on the slot machine. Because until there's an out of order sign on it, I'm going to keep putting quarters in it, and eventually if I see, oh gosh, or it's unplugged, or the slot machine has a sign on it's broken, then I know that one doesn't work anymore. So I've got to try a different way to get paid. So remembering that, it's never going to go away unless we teach them that piece is gone. So when we think about discipline, there does have to be discipline in life, obviously. There have to be consequences for behavior. When we implement the selective attention, when we're not paying attention to behaviors that we don't want, that's a form of discipline because we're implementing a restriction of attention. For older kids, it's not attention, it's restriction of privileges. So when they get to be like over age 10-ish, up and above, 10 and under, you can still kind of do that restriction of attention. 10 and above, you kind of have to do more restriction of privilege than that. Because when they get to be that age, it's not our attention that they want, it's their peers' attention that they want. So taking our attention away from them is kind of like, yes, mom's not paying attention to me anymore. So restriction of privilege when they get older, restriction of attention when they're younger. Because again, it's what things are their, what's their, what exactly is their monetary motivation at this point? Is it attention? Is it attention from peers when they get older? So you got a goal. You got to think about the goal. So when we think about consequences, that restriction of attention is always going to be your go-to. So I'm always going to tell you, doing a discipline strategy is your absolute last resort. There's a behavior happening that's not aggression. I always want you to go to your CPI flows. Always want you to use those first. That being said, when you start doing a special playtime with your child every day for 5 minutes, you're going to see behaviors get better, just in general. You're going to see regulation get better, behaviors get better. They're not going to be perfect. No kid is 62%, remember. But we need to realize that just by building connection, you're going to see improved behavior in that child. Now, there are going to be times when you don't get all the behaviors, positive behaviors that you want. So PCIT, the discipline strategy they use is timeout. And they use timeout because, it's been studied and studied and studied and studied, and it actually has been proven that it is the most effective discipline strategy that's available to us. And we also know that it has to be done the right way. And that's the tricky part of it, is that timeout's got kind of a little bad rap over the years because it wasn't done correctly. And the goal of it wasn't necessarily, it's not meant to be aversive. It's not meant to be something that is, awful for the child. It's meant to be a learning opportunity for the child. And it's meant to be exactly what it sounds like, a timeout to think about the choice that I made, a timeout for the parent to chill and have some time away to think about it as well. So when we think about timeout, lots of times I'll go into, when I go into a home for the first time, I'll see a parent say to a child, the child's standing on the chair, jumping up and down, it's not safe. And they'll say, get off the chair. The kid doesn't get off the chair. And they'll say, get down off of there. So that's 2 times. And the child doesn't get off the chair. And then the child tips the chair over because they were jumping on it. And then the mom says, I told you that was going to happen because you were jumping on the chair. So that was kind of like a third warning to some extent. There was no consequences involved. Nothing happened to kind of keep that behavior from happening again. And there was no connection in the moment either. So timeout really is not about a timeout because a child misbehaved. Timeout is for the purpose of, I gave you a direct command and you didn't comply with that direct command. So we're not going to put a child in timeout because they did something they're not supposed to do. We would use timeout because we told a child to do something they didn't do it. So a timeout is used for a non-compliance, basically. And so the reason we only use it for a non-compliance is because before we put them in timeout, we're going to give them the chance to correct their behavior. So when I said, put your feet down on the floor, and they didn't do that, that was a direct command. We are going to give them a second chance because kids are young and they need to have time to think about it. So I'm going to phrase the command in the positive because everything that gets attention increases. Remember that concept. So if I say, quit standing on the chair, it's the auditory recency effect. They heard standing on the chair. So the next time they see a chair, they're going to think standing on the chair because it's the auditory recency. So we're going to say, put your feet on the floor. So I want them to hear in their head the positive part of that behavior. Think of it as the positive opposite. This is the positive opposite of what I want you to do. Put your feet on the floor, direct command. I'm going to give them 5 seconds in my head. 1,000, 2. If at the end of 5 seconds they're still standing on the chair, then I'm going to give them a warning statement. If you don't put your feet on the floor, then you're going to have to sit in the timeout chair. So I've given them a warning statement. I've also restated the direct command so they heard it again, just in case they weren't listening closely the first time, just in case they were jumping and didn't really think you were serious about it. But again, this is where that predictability factor comes into place because when they hear the warning statement, you did one command, one warning statement. When they hear the warning statement, they know that's the end. Whereas the example I gave before, we were already at 3 warnings before anything ever happened, and then the chair tipped over and maybe someone got hurt. So direct command, warning statement, and then 5 more seconds. If they get down off the chair at that point, big labeled praise. Thank you so much for putting your feet on the floor. And you're going to be really silly about putting your feet on the floor. And you're going to stomp because putting your feet on the floor can be so much fun. So much more fun than standing on the chair. So you're going to stomp and you're going to dance and you're going to do all these things with your feet on the floor. And you're going to talk about, we can stomp with our feet on the floor. And you're going to do a lot of that kind of stuff. You made such a good choice. And we're going to make sure you do a labeled praise for that as well. It's a really great choice. I love that you decided to put your feet on the floor. You're showing me how smart you're getting. You're making such good choices now. I love that. Lots of labeled praises for those really strong choices because, again, we want them to recognize that they're in charge. They're in charge of their behavior. They get to decide those things. So then we can go about our day. They got down, we did labeled praises, we move on. Let's say, and this happens, that's, remember, 62%. They're standing on the chair. Put your feet on the floor, please. No feet on the floor. 5 seconds. If you don't put your feet on the floor, you will have to sit in the timeout chair. Wait 5 seconds. Still no feet on the floor. We're going to walk over to the chair and we're going to say, you didn't do what I told you to do, so now you have to sit on the timeout chair. Escort them. If you don't think they're going to walk nicely, which they probably are, you're going to escort them to the timeout chair. You're going to sit them on the chair and you're going to say, stay on the chair until I tell you to get up. And that part is important because sometimes people will let children go to timeout and then they'll let them get up when they think the child says they're ready. And that's not how timeout works. Timeout works when you say they get to get up because you get to be in charge of this part of the process. This is one of the situations where you're leading the situation and not them. And it's important for them to realize that you're leading in these discipline scenarios. So you're going to say, stay on the chair until I tell you to get up. For 2 to 7-year-olds, 3 minutes is the optimal time. You don't have to add a minute for every year. 3 minutes is enough. I generally, though, do 2 minutes for my 2-year-olds because they just are learning how to regulate. It's hard. But 3 minutes for the most part is enough. Now, 3 minutes, but 3 minutes plus 5 seconds of quiet. So if my kid's sitting in timeout and they've been there for 3 minutes and they're still screaming and being crazy in the chair, they don't get to get up. You have to get 5 seconds of quiet, or at least 3 seconds of quiet, before they get up. And the difference is, if I allow the child to get up when they're still screaming and having a fit, then I've just taught them that they don't have to regulate their body. They can just scream and have a fit, and I'm still going to let them get up. And the importance of them regulating is because then they've taught their brain how to regulate. And that's important because that's a pathway. We need them to build that pathway of how to regulate and how to calm so that they can access that pathway another time. If I don't ever require them to regulate, they never build that pathway. And then they never have that pathway to access as they grow and get older. So I need them to be able to regulate. I need them to be able to calm themselves down. Sometimes that takes 10 minutes. Sometimes it takes 15 minutes. Sometimes it takes 1 minute. It doesn't matter. But even if it takes 1 minute, they're going to sit there for 3. And at the end of that 3 minutes, or whenever it is they've regulated, you're going to walk over and you're going to say, thank you for sitting quietly on the chair. So label praise for the behavior we want. Are you ready to come put your feet on the floor and dance with me? And so timeouts in this model, that's why timeouts don't happen just for bad behavior. Because timeouts are just an opportunity to take a breath and then come back and do the direct command. So if I were to say, put your clothes in the hamper, and they didn't, then they would, have to go through the timeout process. I would walk over and say, thank you for sitting quietly on the chair. Are you ready to put your clothes in the hamper? And if they say no, which they will sometimes, you're going to say, stay on the chair until I tell you to get up. And you're going to start your 3 minutes over again. And then you're going to walk back, say, thank you for sitting quietly on the chair. Are you ready to put your clothes in the hamper? They say, yeah. Then you walk over with them to the clothes. You're not going to say anything else. You can point to the clothes if you want to. If you think they need another reminder, you can point to the clothes in the hamper. They only have 5 seconds, though, to comply. And if they don't, because they'll say, yeah, and then they'll walk over here, and then they'll start picking something else up, and they know the clothes are there, but they'll start playing. And if 5 seconds goes by and they still haven't picked up the clothes, then you're going to walk over and you're going to say, you didn't do what I told you to do, so now you have to go back to the timeout chair. The timeout chair, stay on the chair until I tell you to get up. Minutes. Back. Stay quietly. Are you ready to put the clothes in the hamper? Same process again. Now, I have probably every house I go into where they tell me they won't stay in the timeout chair. They won't stay in the timeout chair. So staying in the timeout chair is about regulation. About, first of all, compliance too, but it's also about regulation. Keeping my body on the chair is regulation. So one of the first goals, if they're not staying on the chair, is about teaching them how to stay on the chair. And we do that with what we call backup space. So you need to think about a space in your house that is a safe space that you don't care to take her, that she would stay by herself for 1 minute plus 5 seconds of quiet. So it can be the bedroom, if you feel like she's safe in there without supervision. Sometimes people will use like a house will have a hallway, and they'll just put like a gate at the end of the hallway because they can close all the doors up and down the hall. There's nothing in there for them to get in, and they just put the gate at the end. Some people use an area like that. Just any space in your house, like a little space, that smaller space. We want it to be a giant area that you can take them to. So what that's going to look like is you're going to take them over. You're going to say, stay on the chair until I tell you to get up. and they pop right up. The very first time they pop up, they get a once-in-a-lifetime warning. And that means they hear this warning once, and you never ever say it again for the rest of your life. That warning is, stay on the chair until I tell you to get up. If you get off the chair again, you will have to go to the timeout room, whatever you want to call it. They hop up. You said, you got off the chair before I said you could, so now you have to go to the timeout room. And you're going to take them and lead them to the timeout room. If you're comfortable with them being in there by themselves, you can be in there with them, but it's more effective if you're not. Put them in the room, you close the door, and you stand outside the door, and it's 1 minute plus 5 seconds of quiet. So once you get that 1 minute plus 5 seconds of quiet, you're going to open up the door. You're saying nothing because we want this, again, to be very robotic, very not reinforcing. You're going to open up the door. You're going to lead them back to the chair. Stay on the chair until I tell you to get up. If they hop up, go back to the room. Close the door, 1 minute plus 5 seconds of quiet. Open the door. Stay on the chair until I tell you to get up. You might do that 10 times. But eventually, and it's quicker than you think, eventually kids figure out, this is like boring. Like in the beginning, sometimes I'll get kids that giggle about it. They think it's funny that they're going back and forth and back and forth and back and forth. And then after a few times, they're kind of like, not so fun anymore. I don't want to do this anymore. And so back and forth and back and forth and back and forth until you get your 2 to 3 minutes on the chair. Now, I have had kids, and these are generally kids with developmental delays that I will do this for, where we will work our way up to 2 minutes. We might do 30 seconds on the chair. Over and say, thank you for sitting quietly on the chair. But for your typically developing kiddo, I would go for the 2 to 3 minutes before I would walk over and say, are you ready to go through the close and the hammer? So you're going to do that whole process back and forth, back and forth, back and forth until you get your time on the chair, and then you're finally going to say, thank you for sitting quietly on the chair. Are you ready for your close and the hammer? And then you're going to go back. So the difference in this timeout process compared to what timeout looks like in some houses is that timeout doesn't allow them to escape from the negative behavior. So because no matter what happened, they always have to go back and do what you told them to do. So that's why we only do timeout if we've given a direct command. So you're going to give a direct command for the positive opposite of the behavior that you don't want to happen. So they're running around the room. Come over and sit beside mom. Direct command, which is a positive opposite of running around the room acting like a crazy kid. Now, all of that being said, you have to be pretty choosy about when you're going to give a direct command. Because if you don't have the time and energy to do a timeout in that moment, then just don't do a direct command. Because then you're not tied to a timeout. So again, this predictability factor and consistency factor for our kids, they're going to learn eventually that if I say it as a direct command, and if I then have to give the warning statement, they know that means business, and that means the timeout is coming. If I don't use a direct command, then they have the option to not be compliant, and we have to respect that. So if I say, can I have your phone? You were going to hand it to me because you knew that's what I wanted. But if you just said no, I would have to say, okay, because it was a question. And we do that with kids all the time because we think we're being polite. Can you come over here and let me change your diaper? No. Okay. No, we want them to be able to answer questions and make choices. And so we have to be choosy about how we present that information. No. Can you use your inside voice? No. You asked. So we have to be really, really careful about that. Be careful of when we use direct commands. And that's a lot of why direct commands don't get consistently followed. Because again, we're doing them all day long. We are not requiring compliance to all of them all day long. We're only requiring compliance when it's really important to us. And we're also requiring compliance for indirect commands too. And that's not really fair. You know, if I ask my child to do something and they tell me no, I probably need to respect that because I asked it like a question. So we have to be really pick and choose what you want to use a direct command for. Pick things that are very, very important to you. Now, I would recommend, and PCIT recommends, that you don't implement this timeout procedure until you've done at least a few weeks of this special CDI time. Because what we know is that the timeout is more effective if they feel connected to you. Because they want to please you, they want to be compliant, they want to follow the rules if they're more connected to you. So doing this special playtime every day creates that connection and makes the timeout more effective. It's been studied. You know, they've done studies where they completely took out the CDI phase, where you didn't do the special playtime every day and just implemented the timeout procedure for compliance, and they didn't get the compliance scores that they did when they did both. So we know that combining the CDI with a discipline strategy only when it's needed is the most effective way. They also tried it backwards, where they did discipline first and then did the CDI, the second phase, and it still didn't do it. It didn't have as much compliance. So we know that this connection has to be there. They call it the foundation of it. And then the steps are learning how to comply to behaviors. You can also use this discipline strategy in public. A lot of times people tell me public is awful. We can't go to a store. We can't go to a restaurant. I always tell people that you know, obviously, again, your CDI skills are your go-to. You're always going to use your CDI skills first and set them up for success. You're not going to take them to a restaurant that has 5 courses and you're going to expect them to sit there for 3 hours. Set everybody up for success in that regard. But try to make sure that you're making sure that everybody can manage. Everybody's not sleepy. Everybody's feeling okay. Those types of things. In that situation, you are going to use something called a timeout towel. You can also do this in your home if you would rather do that in the chair. But you're going to have a little hand towel and you're going to carry it in your bag. One of the best tools for that too is to make sure it's hanging out of your bag so that they know I've got the timeout towel. So you're going to have that timeout towel kind of just visual a little bit. And you're going to tell them before we leave, you guys are doing such a great job listening, and I'm pretty sure we're not going to have to use it, but just so you know, if there's a situation where I tell you to do something and you don't use good listening ears, then I have this towel, and that's going to be our timeout spot when we go to the store. And so in the store, it's going to look the same, but you're going to, willing, and I always am, but I would take the timeout towel over to the bathroom or someplace kind of out of the way, put it on the floor, set the kid on it, stay on the towel until I tell you to get up. If they get up before they're supposed to, then you're going to say, you got off the towel before I said you could, so now we have to go sit in the car. And I would take them to the car. Generally at that age, they're still car seated. So I usually would put my kid, I wouldn't tighten it, but I'd put him in a car seat and latch it. And we would do that for 1 minute plus 5 seconds. And then I would just unlatch, I wouldn't talk, just unlatch it, take them back in, towel down, put them on the towel, stay on the towel until I tell you to get up. And we'll do that process like that. So, and it's pretty effective in public because they're like, I can't believe she's doing this in the store. and they're like, oh, okay, I guess. So, but I usually also tell people before you whip out your discipline strategy in public, to practice sessions going to the store that you know are going to end successfully. So you're going to go to the store just to buy a pack of gum. And you're going to say today, you know what, I need some help going to the store today. We're going to walk into the front, and I need you to pick out a bag of chips for me. And then we're going to walk up and I'm going to pay, and then we're going to leave. I would like you to hold my hand, and I would like you to walk beside me, whatever. Give them what you want it to look like, and then you practice. And if you think that that's something they can be successful with, you practice that skill, and that way when you leave, you can be like, oh, that was amazing. You walked in the store with me, and you held my hand, and you walked out with me. You have gotten so good at going to the store. I'm just so impressed. You're doing amazing. And if you don't think that they can even get to the area where the chips are, then your goal is that we're just going to go into the entryway and see if we can find something blue. So you're going to lower the bar to whatever it is you think they can get success at. And then raise the bar a little bit, raise the bar a little bit. You can implement something like a token economy in those situations. Token economies are effective, but they have to be short term. So you don't want to use a token economy for something that you're going to have to do forever. So a token economy meaning, you did such a nice job walking into the store. When we get back to the car, you can have one M&M, or 3 M&Ms, whatever the case may be. You don't want to have to do that forever. And then that's part of the reason that we do CEI is because we want your attention and your mentioning of their positive behavior to be the most reinforcing thing they get in their entire day. More reinforcing than chocolate, more reinforcing than a toy, more reinforcing than anything you can give them is hearing you praise them. And that comes through that connection and that play. And so, again, that intermittent schedule of reinforcement that we talked about being the most successful way of reinforcing behaviors. So sometimes token economies can work in your favor in that way. So you're not going to give them a couple M&Ms every time you try this, but sometimes you might be like, oh, you know what? I realize I have still a few M&Ms. You did such a good job. Here, you can have those. And then the next time you're like, oh, shucks, I don't have any M&Ms today, but you did amazing. I'm so proud of you. You walked all the way into the store and back out. And then maybe 3 times later, you're like, oh, I forgot I had some candy in my pocket Dad gave me, and here it is. So you can do, or save up the toys that come in the Happy Meals and things like that, or stash them in there. Like, look, I forgot I had this. You can have this because you did such a good job. So the surprise factor is a big thing. Again, it's like the slot machine. We don't know when we're getting paid. It's exciting when we do. So making that factor a piece of it as well. Let's see. Tell me. Ask me questions. What kind of things? Yes.
So with the CDI,
Yes.
with having the girls,
Yes.
is it still going to be effective if it's like me and both of them doing it, or even all 4 of us doing it together? It has to be one.
It has to be one. So best scenario would be if you guys can do it at the same time with opposite and then switch.
Okay, so like
So-
we would each do like 5
Yes.
minutes with each girl and then
Yes.
switch.
10 minutes a day.
Okay.
10 minutes a day. Yeah. So you can do it any time of the day. You can do it first thing in the morning. You can do it whenever. It doesn't have to be the same time every day. You can pick whatever time you want it to be. Some people decide that they want to work it into a routine of their day, so they might do it like at bedtime. They go do special playtime and then brush teeth and read a book and then do bed. And they only do that just because it's easier for them to work it into the day. But that's not something they have to do. You can do it anytime. You can do it separately. Even if there's a day that one of you guys is somewhere and you can't make it work together, you can do it that way as well. But you can set one of them up with, a tablet or something, 5 minutes. Have it like the time. That works as well too. And the best scenario is that both caregivers are going with. I do have houses where only one is doing it. It's still effective, but if both of them can do it, it's better.
Another question. A lot of this year was like the revamp, but like
Sure.
especially like the really positive effective behavior
Yes.
stuff. But one of the girls, like dangerous situation.
Yeah.
Like she has a tendency to hold.
Yes.
And it's typically like as we're leaving the house, going to the car, and then
Yeah.
she's up the street.
Yes.
Or in a parking lot, and she just gets holding hands
Yeah.
and then gets loose and she
Right.
holds.
Yeah.
And in those situations, like that's not safe for us to like ignore obviously that behavior and like wait for her to come back, like we have to run after her. But that's definitely the reaction that she wants. She says she's laughing, she thinks it's funny that we're chasing her,
Yeah.
even though I'm yelling, stop,
Yeah.
you need to come back,
Yeah.
and whatnot. So
Yeah.
in those situations, like how do we redirect that
Right.
behavior? So like
So in those situations, there are 2 things that I would do. Excuse me. One is in the situation where there are times she's still going to get away from you. In the situation that she gets away, you have to get her. You're going to get her, but you're not going to robot. Get her and you're just going to walk quietly back to where your house is or wherever you need her to be. And you're going to go in and you're going to close the door wherever you were so that she can't escape again. You're going to wait till you're ready. And then you're going to say, that wasn't safe. You need to go to the car. I'm going to hold your hand. So you're giving 0 attention to that behavior. And then if you can get, if she'll hold your hand and walk to the car. Then you can start. You want to reinforce it, but you don't want to give a big reaction to it. And again, then you're setting her up for a big reaction. Get to the car, you take her, you put her in. The next time you go to leave to go somewhere, before you get ready to leave, you're going to say, we're going to leave in 5 minutes to go such and such. When it's time for us to leave, I'm going to hold your hand to the car. And you're going to take her hand. But even though you're the one initiating it, as you're walking, then you can give your big reaction because she hadn't taken off, because she didn't have a chance. Thank you so much for holding my hand. Let's march to the car this time. Or should we walk like a dinosaur to the car this time? You can even at times give her choices. And sometimes too, depending on the kid, after she runs off and we get back to the house and everybody calms, you can say, we're going to go to the car now and I'm going to carry you because you weren't safe. And then the next time you go to the car, you can say, we're going to go to the car in a few minutes and why don't you decide how I'm going to hold your hand when we walk to the car, but let me know, do you want to walk like a dinosaur to the car? Do you want to hop like a bunny? You decide. And then I'll hold your hand and we'll hop like a bunny or we'll walk like a dinosaur. You let me know, you think about it. So that way you can reinforce that positive behavior and still forcing her to do what you want. Forced choices are a great way to require compliance of a kid without giving a direct command. So, hey, it's time to go to bed. Do you want me to carry you up the stairs or do you want to march like a soldier? So I didn't give them the option to not do it. I gave them the option to do it. And they get to choose how. If they say, I don't want to go to bed, then you're going to say, I think I'm going to pick how we're going to do it and I'm going to carry you up to bed. Basically indicating like you didn't make the choice, so now I get to make it for you. Kind of like a timeout process. You didn't make the choice to do what I told you to do, so now you have to go to timeout. You didn't make the choice to either march like a soldier or have me carry you, so I'm going to make the choice that I'm going to carry you. So forced choices can work really well in those situations because they're not direct commands, and you don't have to follow through with a timeout procedure, which I do not recommend at bedtime. Because also that becomes an avoidance strategy. If I do this at bedtime, then I don't have to go to bed because I can go to timeout 14 times. So don't do timeouts at bedtime. Don't use a direct command for bedtime. Come get in your bed. Don't do that. Because they say no, and then you're in a timeout procedure. You gave a direct command, so you have to do a timeout. You have to do a consequence. Now, sometimes you can do, in other situations, you can do a timeout of a toy instead of the child. Because you don't want to get in a situation where you're having to do timeout with their body over and over and over again. So if they're throwing something or they're unsafe with something regularly, you might say, and it's an aggressive type of thing. So in an aggressive situation, you can use timeout. So if they're hitting, kicking, punching, that kind of stuff outside of special time, during special time, you're just going to end special time. Outside of special time, you would use a timeout. Because aggression needs an immediate, consistent, predictable response every single time in order to extinguish it. And there is no warning. So if they come up and hit me, I'm not going to say, if you hit me again, you'll go to timeout, because I'm basically fighting them to hit me again, because it doesn't give me it doesn't give them the option to have a positive opposite of the behavior. You know what I mean? So, if he hits me, I'm going to say, you have to go to timeout because you weren't safe. I'm going to take over it and put him on the timeout chair. So let's say that they're using a toy and they're, throwing it and it's going to hit a light or something like that. I might just walk over and get the toy and say, this toy is in timeout for the day because you weren't safe with it. I put it up on the shelf. Now, that being said, I might put it up, I might not put it safe for the day. This toy is in timeout now because you weren't safe with it. And as soon as I see them playing safely with another toy, I might get that toy down and say, you're playing so safely with this toy, I think you're going to have this one back because I saw you being so gentle with that one. I know you know how to be safe with toys now, so I'm going to put this one back down for you. So that's a built-in reinforcer, and it doesn't require you to do a timeout situation. Okay, does that make sense? Yeah. Any other questions?
Kind of answered this one
Yeah.
already just now, but are there other biggest behavior she likes to pull her down.
Sure.
And teaching Ellie like use your voice,
Yeah.
you know, like that, or
Yeah.
during course that no, be like answer yourself. But would that be considered more like aggressive behavior that we should just something, or would we give her a chance of like self and then
How many times a day
varies. Like some days like she does it a lot, and other days she doesn't do it at all.
Okay. So
Yes.
I would say. What's that?
She thinks it's funny,
Of course.
and it's not
So you-
necessarily
so
that she's like
she's-
hurting him
Right.
either.
So she's laughing, so it's more like a reaction.
Yeah, it's like she's trying to give her almost like a big hug, but then she just gets like too tight and then pulls her to the ground.
Right. Yes. I mean, if the goal of it, you feel like truly is a reaction or attention, then I would do the direction. That's tricky though, because it is somewhat of an aggressive behavior. So I think usually what I recommend in these situations is that you walk over, at least one thing, you walk over and so sorry that that happened to you. Let's go over here and play something. So that Ellie's getting all of the attention in that situation.
Now, some situations, before we get a chance to kind of Ellie's friends, is to bite Penelope. And so now we've got these two behaviors that we don't want either of them doing.
Yeah.
But also in Ellie's defense, I'm like,
She's
well,
like, well,
she's not letting go. I asked her to let go.
Yeah.
This is all I have left.
Sure. So in that situation, I still think I would go over because Ellie's not. She doesn't initiate aggression at all.
No, and like you said,
Oh,
it's not like she goes up to her, like, she's not a biter. She's like, it's literally just because.
Yes, personal stuff.
Yeah, right.
So I think I would still walk over to her and I would say, words, stop, Penelope. I'm sorry that she speaks to you like that. I'm sorry that that didn't feel good. So you're still kind of redirecting that and you're giving her attention. But I wouldn't talk a lot about the biting because we don't want that to be behavior that like, I was like, oh gosh, when I do this, I get stuff and hugs.
Yeah.
But I would walk over and say, oh, Penelope, I'm so sorry she did that to you. Let's go over here and play with something safe.
Yeah.
No.
No. Okay. Right. I mean, that was like a mark up too. Like,
That's been our attitude all week.
No, honestly, natural consequences are the most effective consequences.
Yeah.
That's why removing attention is so effective, because it's a natural consequence. In life, people aren't going to pay attention to you if you're doing something that's really annoying or others. They're just going to go away from it. They're going to be around that. That's a natural consequence. So, I have people say, oh gosh, I don't want to take attention away from them. No, you do. That's how life works. That's how life works. We don't get attention for things that people don't like as adults. We're not going to teach them that they're acting negatively. Do that, So it's important that they realize if I behave this way, I don't get attention. This is how I get attention by using positive behaviors. Now, you guys have little ones, but so we're not going to withdraw attention from a child if they're under the age of 2. So we're not going to use any ignoring tactics under the age of 2. We're not going to use timeout under the age of 2. Okay? Because kids can't regulate themselves on a chair until they get at least to be 2 years old or older. They can't control themselves and keep themselves on a chair until then. And neurologically, physiologically, their brain can't regulate to get themselves to calm down until they're over the age of 2. Okay? And if a child has developmental delays or something like that, you obviously keep that in mind because sometimes even after the age of 2, they still can't do that. Sometimes they can be a little older if they have issues with development or something like that. But for the most part, so for under 2-year-olds, you're going to use the CDI skills, just minus the discipline strategy. Okay? You're not going to do a timeout until they get to be over 2. And hopefully won't need it very much if you start CDI before age 2. Or before age 3. So, trying to think of I can keep up that. Finelli.
Okay. Yes, yes.
Yes.
One. Right, and she's most of the time.
Yeah.
And then again, she like hugs too tight or
Yeah.
puts her tail or whatever.
Yeah.
We're constantly doing
Yeah.
I'm sure anything.
So I would do the timeout strategy for that, but the other piece of that is that you want to touch her every single time.
Right.
Every single time she's touching the cat
Yeah.
gently and ultimately ending the interaction before it goes back. She's being very kind to the cat, you're going to go with her. I know this is an option every single time like to, but to walk over and say, gosh, you're being so sweet to her. I love how you're petting her so gently. She's going to love you so much because you're being so gentle with her. And then you might do a passive redirection like, I wonder if your hair feels as soft as the kitty's hair. Mommy's hair feels soft as the kitty's hair. And you're going to direct her to touch something else. And just out of the way and just kind of move on. But let's find other things that feel soft like that. Do you do anything else? Do any of your animals, your stuffed animals feel like the cat? So that you can end that interaction before it goes bad. Because in these situations, kids that tend to be kind of impulsive, dysregulated types of kiddos, when they're young, it's good until it isn't. So they have the skills, but they can't maintain them. So end it before it goes bad, so that it doesn't put you in a situation where you have to talk about the negative behavior. It allows you to really focus on that positive behavior. And it also, do you feel like her attention span and focus is good? Like, can she sit and play pretty well for a while?
Yeah.
Okay.
That impulsivity is
Yes.
definitely
Yeah. So she's probably getting a little bored. Like, this is fun. I know what I can do to make the cat yell. And it's not a conscious process in her brain. She's not like premeditating, I'm going to pull the cat's tail. It's, again, a pathway. Pathway is, I play with this cat, I pet him, and then I pull his tail. That's the pathway. It's like the concept of riding a bike. You don't have to get on the bike and think, lift this leg up and lift this leg up. Your legs just do it because the pathway is there. It's already built. Pet the cat, pull the cat's tail. The pathway's already built. So we got to redirect the pathway to one that's pet the cat. Oh, find something else to So building new pathways that interrupt that one that is really reinforced over and over. Pets are hard because pets reinforce the behavior on their own.
Yeah,
I know,
keeps
we're
coming
like,
back.
stay behind the gate, like,
Yes.
stop coming out.
They keep coming back, and then they meow about it, or they hiss, or they scratch. They immediately react. So finding a positive opposite of alternate and thinking it before it goes bad for that. Are there times again when she interacts with Ellie well?
Oh, yeah.
Oh,
Yeah.
I mean, they're sweet.
Oh, okay.
They have a really good relationship with each
Yeah.
other, just it's like the impulse thing. All of a sudden she
Yeah.
just
Right, they'll
starts.
be playing like perfectly fine, bad, right, whatever, and then also
Want to like tackle her and like give her a hug and then like lay on top of her and giggle
Yeah.
because it's funny and Ellie doesn't like it. So it's like, let me go, and she just laughs more and she's getting
Right. Yes. So the other thing that I would say about that is once you've done CDI with both girls individually for maybe 6 to 8 weeks, something like that, you might try a few sessions a week with them together. Where you're going to do 5 minutes together, and you could probably do all 4 of you. And during that time, you're going to really focus on doing label previous for her positive behavior with Ellie. You're doing such a good job. You can use yourself. And you guys, that was the other thing I was going to say too. It sounds goofy, but you can do it with each other as well to model those types of things. Like when you're at the dining room table or whatever, or when you guys are playing. Thanks, Dad, for handing me that toy so gently. I love it when you're really, really gentle with these toys. It's really fun to play with you when you're doing like that. Same those types of things. Adding, I didn't say this earlier, but I should have, adding positive touch to a labeled phrase increases the value of the phrase. So if I come over and say, rub her shoulder, something like that, putting a tactile input on that can be better. That's right. Same thing with spouses. Yes. Thanks for the dinner. It was really good. Yes. Yes. So the same thing, so when you guys are all playing together, you can reach out and touch Dad and say, hey, you're being so gentle with my toys. And Dad can say, oh, that was a really nice touch. That was nice and gentle. So that you're modeling like what a nice touch can be. And so when you see her do a nice touch with Ellie, you might even say to Ellie, oh my gosh, Penelope touched you so sweetly. She loves you so much. She used such a nice touch with that. So you're really drawing attention to the actual touch. Very specific about that. So I brought this one as well. Suggested toys for CDI. When you, again, it's about setting yourself up for success. So when you're doing a CDI play session with them, try to make sure that you pick toys that are creative in nature. So like blocks, little people toys, like farmhouses, those types of things, things you can build with, things that are creative. Toy kitchens, toy food, all of that kind of stuff. Things that you want to stay away from toys that have rules because you don't want to have to enforce rules in that situation. Stay away from toys that you think could go bad. So sometimes coloring is not a great thing to use. Sometimes with older kids it is, but with our younger kids, sometimes that's not a great thing because they want to color on the table, or the floor, or their sister, or whatever the case may be. So you want to try to stay away from toys that you think you might have to do a correction on. Because again, that 5-minute special time, we're trying not to do any corrections at all during that time. You can, in some situations, do like a gentle correction if you think something's causing frustration. So like if you're playing with dolls and she's trying to get clothes on a baby or something and it's not going on right and she's getting mad, you're not going to just sit there and watch it happen and let her do that. You can do what's called a gentle correction. So you could say something like, I can help if you want me to. That way you're not leading it. You're still giving her the option to keep trying if she wants to. And then also label praise for that. That's a really hard thing to do. I love how you keep trying. You're not giving up. I love that you're not giving up. But if they want you to help, then you can help. You can say, I can help if you want me to. Or if they get mad and just put it down, you can say, oh, that's frustrating. Here, it goes like this. Just show them how it goes. But just try to stay away from toys that you think will not be super frustrating. Toys that you don't think will lead to something bad. So not maybe so much with the girls, but with a lot of boys, typically, they want to do like their action figures want to fight and wrestle and jump on each other and that kind of stuff. And sometimes that leads to like aggressive play because then they want to fight you. And then it turns into this hitting thing. And we don't want our special time to be about us hitting back and forth with each other. So you just don't use those type of toys during special time. It's not a problem with the play, but you don't want to do it during special time. So just stay away from those types of things. Stay away from games that have rules. Because again, if they don't follow the rules, then you're in a situation where you have to decide, am I going to make them follow the rule? Or am I going to just let them play the game wrong? Because then they're going to want to play the game wrong next time too. And so just don't offer those types of games. They recommend that we don't do. They recommend that we don't do toys that create a scenario where you're not being the one talking. So, like puppets are not a great idea during special time. Outside of special time, it's fine. But during special time, you're not going to use puppets because you don't want it to be Elmo that's talking to your child. You want it to be you that's talking to them. Telephone is okay as long as it's you talking to them on the telephone, not you being Cookie Monster on the telephone. I'm talking on the telephone with a child, that type of thing. So this is a copy of the pride skills, and a little bit about why we use each of them, the don't skills, and using that differential. Staying away from any sentence during special time that don't stop it or not. That's right. No wonder you're good.
That's right. You guys do.
So, any other questions?
Oh, so it's not very much bedtime.
Yes.
Rose. number of issues, and I know that she's tired.
Sure.
So like I'm at least one is whether or not to discipline when she's tired of hungry. Hungry is a little easier because like there's some food to calm down.
Right.
But like if she's tired, do we implement
Right.
a consequence? Because then I'm like, the solution is going back.
Sure. Right. Yes, that's what makes it feel better. Yeah.
Yeah, I popped over.
Yeah. So is the problem behavior that she's just not going to bed? She doesn't want to go get in bed. Pretty much.
That's delay.
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 Go to the party.
Yeah. So in those situations, like you probably have like kind of
Oh,
routines every night.
But she knows what's happening.
Yes.
Bedtime, fair enough. Bath time, story time, followed by story time, followed by story time, followed by bed.
So I would say that you be very clear on what the limits are. Like, okay, it's almost time for bed. We're going to, go into the bathroom, brush your teeth, and then we're going to sit down and read 2 books. Do you want to pick the books, or do you want me to pick the books? So we'll give that option. Do you want to pick 2 books, or do you want me to pick 2 books? Okay. Well, you can give her the option. Do you want to pick 2, or do you want me to pick 2?
Oh,
She
she gets
says,
mad.
I'm going to go pick
I
2.
try.
Okay, then you say, oh, you don't want to read a book tonight. So she gets mad. Like if you decide you're picking the book and she gets mad, you're like, oh, you must not want to read a book tonight. I guess you just want to go straight to bed. So you're implementing consequences, but you're implementing them in a natural way. Like if you're having a fit, we're not going to sit down and read a book. So I would say you pick 2 books, and then when you get to book 2 and it's all done, you say, okay, now it's time for us to do hugs and kisses, and then you're going to go to bed. And you're going to put her in bed and you're going to walk out. She in crib or bed?
No.
Okay, yeah. So does she come out of the room?
Oh, yeah.
Yeah.
Or,
Right. Yeah. But is it at bedtime? Does she generally stay in her bed even though she's awake?
Well, nap time, she will come out.
Okay.
that-
Can you close the door? Are you comfortable closing the
Oh,
door?
Oh, we do.
Oh, yeah. So
Yeah,
that's
she
what
does.
I would do.
I'd lock the door if I didn't feel like that zombie got another way.
So you can lock the door.
Yeah,
You can lock the
Okay.
door. Absolutely. Yeah.
that would be a
You
good
can
idea
lock the
then.
door. You can turn the doorknob around
That's,
too.
that's
With a
the
lock on
next
the
step.
outside.
Oh,
Yeah, you can put the safety knob on the
Yeah.
inside. Yeah.
Okay.
Put the doorknob cover on the inside. So that she
So it's okay, because like I'll close the door and then they're screaming like
Yeah.
But okay.
Yeah, it's okay.
All right.
Yeah.
That might work then.
Because she knows that if she's screaming like a banshee, then you're not comfortable with that if you're going to come in. Okay. Yeah, so that's why it's working.
Okay, that makes sense.
Now, when she calms down and gets in bed, you could go back in then if you want to reinforce that behavior. Like after she's quiet and calm, even if she falls, like lots of times in this situation, they fall asleep on the floor
A lot,
because they
yeah.
don't get back in bed. So if once she's calm, you can go back into the room. And walk out and close the door again. Because you want to reinforce that regulation. Like you got yourself calmed down. Yeah, absolutely. You can lock
I feel like
the
it's
door.
hard to fall asleep when you've been screaming the prior 10 minutes.
Right,
But,
right. Yes,
Right,
it
okay.
is, but she just has to learn how to regulate.
okay.
She just has to learn how to regulate that emotion. And again, like you said, it's an avoidance tactic.
Yes.
Yeah, so the goal of behavior is to avoid going to bed, and it's working. Because the longer I scream, the longer I don't have to go to bed. Yep. So I'm going to give Christy a link that she said she would send out. It's for a YouTube video that's called Managing Your Child's Behavior in 5 Minutes a Day, something like that. It's basically the information that we covered, but it's a webinar that was out there. It's an hour long, and so it's not like a refresher or something like that. And it's actually done by Dr. McNeil. So we'll have that as a